Hello, my name is Priscilla Meehan, Community Relations Manager at Santa Clara. And the big question is, that parents are having right now is how to get their kids started or returning back to school during COVID-19. I'm talking with Dr. Averyt about keeping kids healthy and engaged for both online and in-person learning.
Thank you so much for having me. I'm very happy to talk about this very important subject.
So the question number one is, my child's school year begins online. What can I do to prepare him or her?
As we all know, schools provide so much more than just academics to children and adolescents. It's a place where they learn social and emotional skills and other things that just can't be provided online. So there are a few things that parents can do to make sure that their kids can return safely in person to school. One is staying in touch with your child's school. Many schools are offering lessons online, also known as virtual learning. So it's important if your student is in virtual classes to review assignments from the school and to help your child establish a reasonable pace for completing the work. It's important to create a schedule and routine for learning at home, but keep in some flexibility there as well. Consider your child's individual needs for learning and adjust for their age group. And maybe, most importantly, look for ways to make learning fun.
Great. So question number two, what should I be looking for as far as my child's school to do when in-person classes return?
A lot of the things that your child's school can do are the same things that we should all do to protect each other from the coronavirus. Firstly, physical distancing is so important. The goal should be for students and teachers to stay at least 6 feet apart to help prevent the spread of the COVID-19 virus whenever possible. Also important are face coverings and hand hygiene. Frequent hand washing with soap and water is important for everyone. Remember, that's at least 20 seconds of washing with soap and water. In addition, all adults and secondary school students should wear face coverings. This is middle school on up, especially if they can't stay 6 feet apart. Preschool and elementary students can benefit from wearing face masks as well, but only if they don't touch their mouth and noses and that mask a lot. Cleaning and disinfecting can also help prevent spread the virus. Schools should follow CDC guidelines on proper disinfecting and sanitizing classrooms and common areas.
If my child is scared to go back to school, how can I help him or her feel at ease?
The start of a new school year can be stressful at the best of times, let alone in a pandemic. Talk to your children about what is worrying them and assure them it's natural to be anxious during this time. Maybe even share how you've been feeling as well and how you've been coping. Children may feel nervous about returning to school, especially if they have been learning at home for months. Prepare them for some changes they may expect at school, like wearing a mask or keeping 6 feet apart. And remind kids about the positive things about going to school, like they'll be able to see their friends again and the opportunity to learn new things.
How can Legacy help families make sure their children are healthy enough to return to school?
At Legacy Community Health, we provide a wide range of health services for your children as they prepare to return to school. One of the most important things parents can do before the start of school is to ensure their kids are up to date on their immunizations, even if classes are only returning online. If your child participates in extracurricular activities like sports or band, talk with your Legacy pediatrician to see if they need a pre-participation physical exam or a well child visit, which are also very important. At Legacy, we provide behavioral health support for children and adolescents struggling with stress from the pandemic. We even have telehealth visits available for this. For more information, contact Legacy to schedule an appointment.
Thank you so much for joining us today. I'm Priscilla Meehan with Legacy Community Health. Thank you for watching.
Thank you.